my name is Anna. I'm a student nurse. Is it okay if I follow you around today?
Yeah, that's fine.
Can you go ahead and give me your S-bar?
Absolutely. Okay, so in room 529, we have a Mrs. Marta Yarn. She's an 80-year-old female. Her doctor's name is Steve Jolly. She has no known allergies. She was admitted today and is a full code at this point. She is widowed, lives alone, has 2 children that are out of state that she doesn't talk too much, so she doesn't have a lot of family that visits. And she's slightly hard of hearing. And her main complaint, or the reason that she's here today, is because she has a non-healing sacral ulcer that she's had for about 3 months. And it's a stage 3. It's 4 by 4 by 1 centimeter. And it's making her pretty uncomfortable. So she's also been admitted in the past 6 months for dehydration and pneumonia. Right now she's reporting a decreased appetite, and her skin breakdown actually started after her admission 6 months ago. So at this point, she's reported being a 6 out of 10 on the pain scale. So we gave her acetaminophen and oxycodone for that. We're going to have to check back up on her pain. She's awake and alert times 4. Though she's anxious, she is cooperative. She's Perla, has full range of motion in all of her extremities. She's up with a walker, and she's standby assist. Right now she's complaining also of generalized weakness, so she doesn't like getting up and around. So her lung sounds are diminished in her lower lobes, both lobes, but she's clear in her upper, and she has a non-productive cough. And her apical pulse is regular, her peripheral pulses are 2+ on all extremities. Her cap refill is less than 3 seconds in all 4 extremities. So she's on a regular diet right now. She is NPO after midnight because she's supposed to be receiving surgery. Her bowel sounds are active in all 4 quadrants. Her abdomen is soft and non-tender, and then she has no feeding tube or anything put in. Her last bowel movement was today, and her stool seemed like it was firm and normal. She ate about 50% of her last meal, so she doesn't have much of an appetite. She is a self-void. She doesn't like to get up much. Right now, her urine appeared like amber in color, and she had protein, according to her urinalysis, so she had protein in her urine, so that's not generally a good sign. Right now she's on intake and output, and she had taken in about 850 milliliters since we've had her and has only put out 350. So she's retaining fluid. And she is complaining of occasional stress incontinence over in the nighttime, so she's experiencing nocturia. So what do we got here? She has a right dorsal metacarpal IV site. Her vitals? Her respiratory rate is 24, so she has, that was actually a little ways ago. So we'll check in on her pain and see if that's doing better. Heart rate is 88, O2 stats 92 is a little low, and her BP is a little high at 144 over 90. So test-wise, her doctor had ordered a CBC with differential metabolic panel, INR, PT, PTT, urinalysis, X-ray and electro, 12 lead electrogram, and then CNS blood culture. So CBC had shown increased white blood cells. The metabolic panel told us that she has increased BUN, so her kidneys aren't happy. And the urinalysis, like I said, showed protein, but also white blood cells in the urine, so there's kind of a good chance she has an infection. And then her culture and sensitivity show that she has E. coli in her bloodstream. So we got our work cut out for us. But yeah, we're supposed to hook her up with some gentamicin and normal saline with potassium chloride. And yeah, I think that's about it.
Okay. So why specifically is this client receiving this medication?
Well, she's actually receiving it because the results that we've received thus far are telling us that she probably definitely maybe has an infection. Based on like the white blood cells in her urine and the blood culture revealing E. coli in her bloodstream. So yeah, no, she's got an infection.
Okay. And what action does the medication does?
A little complicated to explain, but basically it's gentamicin, it's an aminoglycoside. It's supposed to bind to the bacteria's, kind of bear with me, like their ribosomes have 30 S units and 50 S unit parts to it, so it binds to the 30S ribosomal subunit, and it kind of like interferes with the messenger RNA's duty of interpreting proteins and setting it up right. So it messes all of that up, and it causes it to make like abnormal proteins and stuff, and then the bacteria basically dies from that. From like
protein.
having abnormal proteins, it's not
Okay.
able to build things right.
Okay. And when should you question administering this medication?
I mean, if the patient doesn't look like they have an infection, you wouldn't administer it. If the patient has an allergy to the medication, you probably wouldn't administer it. If they have increased BUN or creatinine, or like higher than normal, much higher, you wouldn't administer it because that's a sign of nephrotoxicity, and that would just, like, the medication would make it a lot worse. It wouldn't be good.
And what does the medication have a therapeutic serum level?
It does. That's also a little complicated. It has like a peak level and a trial level. So peak level is like when you first administer it, it's like how high it's going to get when you administer it. And then the trial level is like the baseline. So the peak level, you want it to be between like 5 to 8 micrograms per milliliter. And then the trial level, you don't want it to go past 2 micrograms per milliliter. And then especially, you want to watch the peak level, because if that reaches anywhere near like 10 or 12 micrograms per milliliter, that's an issue. Like, that's toxicity.
Okay, and what vital signs must be monitored?
I mean, it doesn't hurt to monitor all of them. You probably want to watch heart rate, because tachycardia is usually a sign that something is wrong.
Mm-hmm.
Repeat the question one more time.
The vital signs.
Yeah, vital signs. Okay, that's what I thought you said. Yeah, I want to say mostly tachycardia, but I would be watching all of them. You know, respiratory rate tells us if she's in pain, so I would just watch all of them.
Okay. And which physiological parameters should be monitored?
Well, all vitals. You kind of want to watch the patient's hearing with this medication because it can cause ototoxicity. So, like if they're having a ringing sensation in their ears, that tells us that it might be at toxic levels in the blood. If the patient is having unsteady walking, or if they're not like on balance, that's ataxia.
Okay.
Because they're not coordinated, so you want to watch for that.
And what intervention must be taught to the client to ensure medication is administered safely in the hospital?
You want to have them let us know if their injection site is hurting at all, or if it's
Okay.
inflamed. If the patient's hearing ringing, like I mentioned earlier, you want them to let us know about that. Don't let them get up to go use the restroom by themselves, because if they are experiencing the ataxia, they're going to end up falling, and that's a whole other set of issues right there. You also kind of want to watch how much they're urinating. Like if they report having less urine output, they need to tell us that.
Okay. And what intervention must be taught for taking medication at home?
I mean, it's supposed to be an IV medication, so they probably won't get it in that way at home. They'll probably, like the doctor might switch them to a PO medication. You would want to tell them to finish the entire medication even though the symptoms go away, because if you don't, you're going to end up building bacteria that are resistant to that medication, and that's the last thing we want.
Okay.
Yeah.
And what are the side effects and potential adverse reactions?
Some of the side effects, I mean, the adverse, we'll do adverse first.
Okay.
Nephrotoxicity, that's a big one, so you gotta watch BUN and creatinine. Ototoxicity, so again with the ear, and then always anaphylaxis when you're giving a new medication to a patient that's not had it before. And then some of the more minor, I mean not fun, but minor side effects would be nausea and vomiting.
Okay. And how would you know the medication is effective?
Well, the next culture and sensitivity that we take should have less, or if any, bacteria left inside of her bloodstream. You want to be doing another urinalysis to verify that the urine is not cloudy anymore, that we're not finding white blood cells in there.
Okay.
Yeah. Patients should probably start feeling better, I would think. And then you want to keep monitoring BUN and creatinine.
All right. That's all the questions I have for now.
Okay. So we'll go in and visit the patient.
All right.
All right. Hi. Mrs. Yarn, my name is Brittany. I'm going to be your nurse today.
Hi.
And then this is my student nurse, Anna. She's going to be watching me do that.
Oh, okay.
All right, how are you feeling?
I'm feeling great.
Okay, are you having any pain right now?
No, not really right now.
Okay, that's good. All right, I'm going to go ahead and check your wristband. Can you tell me your name and your birthday?
Yes, my name is Marta Yarn. I'm 80 years old.
Okay. And then do you have any allergies?
No, I do not.
Don't have any allergies. Okay. Give me just a moment to get established over here.
I can hold those.
I appreciate it. Yeah, I've got some teaching stuff over here. That's what she's holding right now. You know, I'm actually going to be administering some medication to you today. It's called gentamicin, and then I'm also going to set up an IV sodium chloride with potassium chloride. Have you ever had either of those before?
No, I don't think I have.
Okay, well, I just wanted to let you know you don't have to take any of these medications. You absolutely have a right to refuse. So if any of them sound fishy to you, I mean, you think you're okay with receiving these medications?
Yeah, I think I am. I think
Okay.
that's what's best for me.
Alright, so like I said, you're going to be receiving gentamicin. Do you know what that is?
No, I don't. But is it for my infection?
It is actually for your infection. So your doctor already came in here and talked to you about that then?
Yeah.
Okay, so because you have an infection in your bloodstream and possibly in your bladder also, we're going to be giving you gentamicin and it's going to start to clear things out.
Okay.
And so some of the signs and symptoms I want you to kind of be watching for. If you feel like you have a ringing sensation in your ear, please by all means hit your call light.
Okay.
And if you need to use the restroom, call us before you do that. We'll have somebody walk you to the bathroom because the medication might make you kind of dizzy.
Okay.
Okay, and then one more thing I want you to watch for. Because you said you've never had this medication before, right?
No, I haven't.
Okay. There is always the chance that you could have a kind of adverse reaction to the medication, and that might make your throat swell, you'll feel really itchy. So if you feel either of those things, please let us know, okay?
Okay, thank you.
Alright. Really fast. I'm going to go ahead and check your IV line, okay? Almost lost my IV flush. Are you having any pain where your IV is?
No, I don't think I am.
Okay, well,
Let's
that's
see after you check it.
I mean, if you had told me you had pain beforehand, I might not have even done the IV flush. So. Okay. I'm going to go ahead and swab this for 15 seconds. And then also going to swab the hub, 15 seconds. Okay, this is sterile, so I'm going to hook this up. Let me know if you're feeling any kind of pain or anything like that. Doing okay?
Yeah,
Okay,
I don't feel any pain.
that's good. And then I would put this in the sharps container if that's what the protocol of the hospital called for. Okay, I'm going to go ahead and get your normal saline and fluids set up now, okay? Okay, so I have 0.9% normal saline with potassium chloride, 20 MEq per 1,000 milliliters. I'm looking at the bag. I'm not seeing any kind of tears or punctures or anything like that. It looks clear. It's not expired. Okay. And then can I have you say your name and date of birth again?
Yes, Marta Yarn, 80 years old.
Okay. You have any allergies?
No.
All right. And that matches up with what I'm seeing in the lab. Okay. Like I said, it's normal saline, potassium chloride. And the dose is right, according to what's on the MAR. And what I'm seeing right in here. And then you're supposed to receive this through an IV, which is how your doctor ordered it through the MAR as well. And right now it is Tuesday at 1500 hours. This medication was ordered to start at 1400, so running a little behind, but we're doing good. Okay, I'm going to put this down for a moment. Aside from that, I checked everything, it matched up. missing a cap here, but we do have a cap on this. It's sterile, not touching it. This is sterile too, I'm not touching that. Just a heads up. There's a bucket down here, so we're going to be using this. And I have the dial flow here. Okay, 2 ends are sterile. I'm not going to touch them. You're all tingled up. Alright, again, there's a cap on here. This. Okay. This is almost filled right. I'm going to bring this up to about 2/3 of the way. Just about there. And then this was clamped like it's supposed to be. Swabs are hiding from me. Okay. I'm going to go ahead and swab this end. And then this is already sterile, so swab this end of it for a few 15 seconds. You go ahead and connect it. And they're sterile. I cleaned one end and one was already sterile. Alright, so now that I have everything hooked up, I will go ahead and prime it. First, I kind of want, well, now I'm going to prime it first. This is open. I'm going to ensure that it's open first. Open. That says open.
Mm-hmm.
Okay. I'm going to go ahead and prime it. It's just going to take a second. I'm just going to loosen this. I'm not going to actually pull it off because I don't need it pulled off yet. Yeah, we're primed, okay. I'm going to reclamp this. So we're primed, we're good. I'm going to leave it down here for a moment so I can recheck again, make sure that this is the right patient and all that. Okay, so one more time, can I have your name and date of birth?
Marta Yarn, 80 years old.
Okay, that's what it says here. I already checked everything so we know that the actual med is right, and the dosage, and the time, and the route. I'm going to go ahead and put in the patient's ID and everything, so give me a moment to do that. I didn't get the green light before administering. Patient's ID in, just gotta do this. Okay. So I put in the patient's stuff. I got a green light. So that's how we know it's okay for me to administer the medication. So I'll go ahead and start her on the normal saline, and then we can get started with that medication. So I'm going to go ahead and unclamp it, and then set it to the right rate, and then have the student nurse look at it to make sure I have it set to the right rate. So So, imaginary patient's hub right here. I'm going to swab the hub again just to make sure that it's sterile and unclamp it so that I have the ability to do it. And then, let's also unclamp this. And then take the sterile cap off because this is sterile. I swabbed that, so that's now okay to hook them both up. I'm not going to unclamp this until after I've hooked it up and set the dial flow. So, take the cap off. I'm going to press it back on it again. Okay, and then I'm going to go ahead and set it before. Let me verify the rate just so that I don't mess this up. Rate looks like 125 milliliters an hour. So I'm going to put this at 125. Like that. Okay? Okay. And patient site's unclamped, and they're both sterile, so I'm going to go ahead and hook them both up. Or in this case, in the bucket. And then I have to, of course, unclamp it so it flows. Alright, so I'll leave that alone. I'm going to wash hands again really fast. I have like half a drip coming out right now. So, because it's taking this long for one drip to go, normally I would wait for 5 drips, but we would be here another 20 minutes if I did that. So, in a normal situation, we would wait for 5 drips. But it's open, everything's right. It's just slow dripping. Okay. So now we need to, it's hiding from me. Now we gotta check on this real quick. It's also intact, not seeing any tears or anything like that. It's not expired, it's clear, looks appropriate. Let me go ahead and X out this. So this is the gentamicin that's being given as an IV piggyback. It's due at 1400 hours, 1500 right now, so that's the appropriate time. I've already stated the name of the drug. They are getting it IV piggyback, so there's your route. Can I have your name and date of birth again?
Yes, Marty Yarn, 80 years old.
Okay, and you have an allergy or no?
No allergies.
Okay. Really fast. I have no idea. Well, I don't not have any idea, but I want to make sure that this can be given with normal saline. So I'm going to check on that really fast. Okay. Because you never know with some medications. Sometimes they interact with each other and it clogs the tubing and then it's a big fat pain in the butt. But in this case, it looks like it's okay to be combined with the normal saline. It's not going to interact. Okay. So that's okay. I always like to do this little thing where I sit here for a few seconds and just make sure I'm not forgetting anything important. But yeah, no, you told me your name, you told me allergies and your age. I'm sure that this is gentamicin, that's what it says here in the MARG. Mind you, it didn't say this in the physician's orders, but I actually called the doctor and I had to verify with him because sometimes he puts things in the MAR and doesn't tell me that it's not in his orders. But I called him, cleared that up. So he did order this. I'm not just giving them this drug on my own will.
Okay.
So she's getting this. What kind of rate are we looking at here? Milligrams in a 100 milliliter solution over 1 hour. So it's 100 mils per hour, or per 1 hour. So that's our dose. Yeah, that's our dose. So I got the right patient, the meds, gentamicin, we got the dose. It goes IV, it's okay with normal saline, and time is 1400 hours is when it was due. It's 1500 right now, so we're on schedule. We're going down, but that's okay. Alright. And then this is all intact, this is all okay. I think we're okay to go ahead and set it up. You're going to have to attach this really fast to the main line because you have to have it hanging lower than the secondary line, so. got this hanging below the level of where the piggyback is going to be. That way the piggyback is going to have higher pressure. It will go before the IV solution. Okay. Same system. This is sterile, this is sterile. I'm not going to touch them. This is also sterile. That's how you know the right dose is in there and they're not cheating us. Okay. And we're clamped. So. I'm going to go ahead and hang it for right now. I still have to swab the site down there and then we have to prime it and everything. So. I'll leave this here for a moment. Bring this up. Imaginary swab for 15 more seconds. This is sterile. This is going to be sterile. Before I do this, hang on. I'm going to have to re-swab this now. Just give me a moment. Let me go ahead and get the ID and stuff out of the way one more time. Name and date of birth?
Marta Yarn, 80 years old.
And allergies?
No allergies.
Okay. We already know we have the right drug. It's going through the right route, which is IV. We verified that. We know we have the right dose. I verified it in the MAR, and we verified it in the provider's orders. And we know it's the right time. So I'm going to go ahead and put in the ID of the patient and the medication. So it's going to take another 2 minutes.
Just verbalize that she. So I'm just gonna verbalize that she has done now the kidney dialysis lab yesterday. Okay.
Okay, got another green. So it's safe to give this to the patient according to what the MAR is saying. Everything is right. Alright, so now that I've done that, I'm going to go ahead and I'm not going to break anything. I'm going to loosen the cap and not take it off completely because it's sterile. And normally you could do this through a backwashing method. I have to fill this, hang on. Don't fill this, just cooperate. Sometimes they get kind of stuck. So 2/3 of the way, like last 2/3. Close enough. Normally you can do this through a backwashing method. I'm not the best at that right now. I'm still working on that. So okay. I'm going to do the normal priming method without wasting too much medication. Not going to touch that. Okay. So we're priming. Leaving that by the bucket as well. I'll swab them right here. 15 seconds. Okay, and after I hook this up to the patient's main IV, we're going to have to readjust the dial flow to the rate that's actually written for the medication. So we already verified that all of this is right at this point, so it's okay for me to hook the med up to it. And I swab this. That's sterile. This is sterile. Go ahead and take this off. Okay. I'm going to go ahead and grab the dial. First I'm going to verify one more time just because. 100 milliliters over 1 hour, so I need to set the dial flow to 100. Okay, does that look great?
Yeah. 100.
Okay. Are we all unclamped? Hang on a minute. You're good. Now you're good. going to be watching for another set of 5 drips. And because of what this drug does to the body sometimes, we'll come back in about 15 minutes and check them again for not only pain, but check and see if they have like the ringing of the ears and all of that. Because it would be bad if they did. Or, you know, we would stop the medication if we had any kind of reaction or anything like that. So I am going to date time and initial both the tubings so that the next nurse coming knows to switch things out. These are weird. Okay, we've already got the medication running. Are you doing okay?
Yeah, I'm doing great.
Alright, we're just going to finish up here in just a moment. Do you remember the signs and symptoms I talked about?
I think you told me something with my hearing, and then maybe like a really bad allergic reaction that I would feel in my throat.
Yeah, you kind of probably, like some people, if it's really, really bad, they'll feel like their throat is closing up and they can't breathe. But, I mean, we've already had this going for a few minutes. At this point, since that hasn't happened with you, and I'm standing right here, if it had, we would have intervened, but you seem like you're going to be okay with the medication. So I don't think that that's going to be any kind of an issue.
Okay.
Alright. And when we had started, I would have put the bed up, and this would be me putting the bed down right now. Just, and, okay. Also, I have a little bit of information to tell you a little bit more about this bug anaphylaxis and associated reactions to it. And I'm going to go ahead and leave this here for you. You can kind of read this when you're starting to feel a little better, or now if you're up to it. So I'll leave this here, and then I can see your call light is right next to you if you need it. I'm doing one last mental check to make sure that I don't forget anything. I don't think I did. We've got labels on the tubing. Okay. So, alright, do you have any questions? Any questions at all?
No, I don't.
Oh, okay.
Sorry.
Don't worry about
I'm
it.
sleepy.
I know. Alright. Well, I'll let you rest, okay?
Thank you.
Alright. If you need anything, just press your call light, okay? Okay.
Alright, I have several other questions to ask.
Okay.
Were there any pertinent information that you reviewed before administering the medication?
Well, yeah, I looked at the patient's urinalysis and blood and sensitivity culture to kind of ensure that they had an infection. And now that we know exactly which bacteria it is, we know how best to treat it, and that's why we picked gentamicin to give to the patient. So,
is there any other pertinent pieces you need to tell me about? Is that all?
I think that's it.
Okay. Did this information affect your decision to administer the medication?
Well, yeah, I would not have given the medication if they didn't have any apparent signs of infection or anything like that. Or if they had had a sensitivity or allergy to that medication, we would have found something else.
Okay. That's all the questions I have for now. Thank you.
Okay, thank you.